this comes, so I mentioned the debates, but actually we also have some lectures, some plenary lectures, and one of them is the Alzheimer's disease, and I'm going to talk and discuss the issue of whether Alzheimer's disease is a disease. So the question is really basically, what do we mean when we say that a disease is a disease? Why do we call it a disease? And specifically in Alzheimer's disease, I'm going to say that we know how Alzheimer's disease looks like. So when I see a patient, I see many patients with cognitive impairment, and I know when I think that this is Alzheimer's disease. And I'm right. I'm absolutely right in maybe 70 or 80% of the cases, but not in the others. So, and the pathologist confirms it or not, but also there are problems with the pathology of Alzheimer's disease because many people have the pathological features of Alzheimer's disease, and after death, pathologists can say, and the person has not been identified as cognitively impaired. So there are false positives and false negatives, both clinical and pathological. And this is basically points to the issue that we don't understand the disease. We don't understand what it means, whether it is really a beta amyloidosis, is that enough, or is there more to it? Is inflammation important or is not? We don't understand the mechanism underlying the disease. And if we don't understand the mechanism, we cannot call it a disease. And therefore, Alzheimer's disease is not really a disease. It is more of a syndrome. And we know many of the factors that are responsible for the appearance of cognitive impairment in old people. And so hypertension and sleep problems and loneliness. But we don't really understand how these factors, which we know as clinicians are important, how they affect the biology of the disease, how they affect the neurons, how they cause neurodegeneration, how this is related to the amyloid deposition or the tau deposition in the brain. So these are the very basic questions in Alzheimer's disease, and we should continue to research this and try to find out more about this.